All right. Hello, everybody. Welcome to Webinar Wednesday. So glad you could make it. We do these every other Wednesday from 1:30 to 3 or about there. We do have them scheduled through the new year. So I'm working on scheduling January on, but so if you know of anyone or have any topics you'd like to see, you know, how to get hold of me, most of you. And so let me know. But I am excited to have Veronica Wiesz here today. She's a project manager with Prevent Child Abuse North Dakota, and I will just kind of let her take it away for us.
Thank you. Hi, good morning. Thank you guys for having, I guess it's good afternoon, isn't it? Thank you so much for having me. I'm honored to be able to present today. I am, like Carly said, my name is Veronica Wiesz. I work for Prevent Child Abuse North Dakota. My job is funded by the North Dakota Department of Health and Human Services, so a grant that we have in partnership with them. So I've been with Prevent Child Abuse since the end of January, so it's been over a half a year, and it's been fun. I've been enjoying learning about my programs and sharing information across the state. The end of October, I was fortunate enough to attend the National Conference on Shaken Baby Syndrome. And so that conference was in Philadelphia. I actually lived there for over a decade. I went to college in Philadelphia. I'm originally from New York. So I highly recommend this conference to anyone who's interested in Shaken Baby Syndrome, including, but certainly not limited to, the prevention, medical, or legal aspects of it. It was really an amazing experience to be in a hotel room full of people gathered for the same reason. At that conference, I did meet the Fishpaw family, and they are composed of, the parents are John and Michelle, and the children are Claire and Grace. Claire, unfortunately, well, fortunately, I guess, is a survivor of Shaken Baby Syndrome. Her mother, Michelle, wrote a book, and that book is called Claire's Voice. So it was nice to meet some families who have been so closely affected by this. Before we get too far into it, I wanted to offer some housekeeping details. One is that if you guys have questions, I'm not going to be monitoring the chat while I am presenting, but Carly will, and maybe at the end she can help me with any questions that are typed. The other thing I like to mention is that this is just a presentation. So it's like an introduction on my work at PCAND, my coworkers, and then a nice overview of the period of purple crying, but it is not meant to be a training. So if the training is something that you are interested in, you would just email me, and I provide my email again at the end. And then I can certainly provide you the documents to go online to the website and do that training. That training is an hour long, and you can do it all at once or in sections depending on your time, and it is a free training. So it is a great thing that is offered through our website. All right, so Prevent Child Abuse North Dakota, we focus on primary prevention. So we are a chapter of Prevent Child Abuse America, and that is the nation's oldest and largest organization committed to preventing child abuse and neglect before it happens. So with programs and resources that enable communities to thrive. Here at PCAND, we utilize Facebook a lot, and so that's where we'll put up any news articles that we've been involved in, events that we're attending or having booths at, as well as any types of classes that are being hosted by our community partners. So on this page, I do have our name on Facebook, Prevent Child Abuse North Dakota. So we would love for you to like us and follow some of the stuff we're doing across the state and your communities. I'd also like to talk a little bit about our team, highlight some of the things that we do at Prevent Child Abuse North Dakota. So we have the director of the Child Sexual Abuse Task Force, Lindsay Burkhart. She works with us, and the task force is a government appointed group that is working towards a comprehensive approach to stop child sexual abuse across the state. Our director, Lindsay, is able to do child sexual abuse prevention trainings, and there's also a resource guide that she and her task force are developing And that will be available to the state by 2023. We're hoping early in the year. Our tribal programming director is Jacob Davis. He works in collaboration with NDSU. He is supported by the CDC and Prevention High Obesity Program grant, and that is meant to apply evidence-based strategies guiding the community, guided by community expertise to increase healthy access to foods and physical activity. So this is currently happening in 2 counties in our state, and they have an adult obesity rate of over 40%. And this project that he works on is known as the Healthy Outcomes Project. We also host the MICV program director, that's Allison Mahoney, and that stands for the Maternal Infant Early Childhood Home Visiting Program. This program uses a 2-generation approach to improving the quality of life for families and their future generations by providing useful information to parents and caregivers. And that would be regarding finishing school, stable housing options, and procuring employment, as well as many more things. So finally, I'm going to talk about my work as the North Dakota Health and Human Services Program Director at PCAND. I work on 6 programs and 1 task force. So some of the things that I am in charge of talking about and raising awareness around are the mandated reporter training and the baby safe haven training. Both of those can be accessed. They're free and they're about an hour long. Those can be accessed by going to our website, and it's right there in the top corner in a banner. The CAP month grant opportunities we will be sharing about soon. So CAP month, Child Abuse Prevention Month, happens in April. And we have $18,000 in grants that we give out to people across the state. And they work on preventing child abuse activities that are family friendly across the state. So they would write a request, and we look at those and we try to hand out all of that money and have some great things happening in April. So definitely stay tuned, please, to learn more about that. We'll be releasing our RFP very soon. We also have the Alliance for Children's Justice Task Force. So that's a multidisciplinary team of people. And we are working towards strengthening North Dakota's systemic responses to child abuse and neglect. So lastly, I'm going to mention the period of purple crying. So the period of purple crying program is an evidence-based shaken baby syndrome abusive head trauma prevention program, and it's been available since the year 2007. This program has 2 main aims. The first one, to support parents and caregivers in their understanding of early infant crying, increased infant crying. And the second one is to reduce the incidences of shaken baby syndrome and abusive head trauma. The program approaches shaken baby syndrome and abusive head trauma and infant abuse prevention by helping parents and caregivers understand the frustrating features of crying in normal, healthy infants that can lead to shaking or abuse. The program provides the opportunity for parents to learn about the crying characteristics from over 50 years of research on normal infant crying, and that was conducted by Dr. Ronald G. Barr. He's a well-known Harvard pediatrician, and many other scientists who supported this. The period of purple crying is designed and approved by people who are well-known pediatricians, public health nurses, child development experts, as well as parents. The program materials are educational, attractive, and relevant to all parents of newborns. They're relevant for all parents while emphasizing the dangers of shaking a baby and making it very clear that that is not a great idea. They are clear, they're memorable, and they're meaningful. They have a positive message. This information is presented at a 3rd grade language level, so they're very easy to understand. And they also represent multicultural and ethnic backgrounds. These program materials are also accepted by public health nurses. So Dr. Ronald Barr, he developed the acronym, which is essentially the program. Purple describes the 6 characteristics of the crying. So every letter stands for a characteristic of the crying. The first P stands for peak. Your baby may cry more each week, the most being in month 2, and then less towards months 3 through 5. And obviously not every baby might not fit that perfect mold, but typically it is around 2 weeks when the crying starts. The peak is 2 months, and then months 3 through 5 is when it's de-escalating. The U stands for unexpected. Crying can come and go and you don't know why. So you might have checked for a dirty diaper, you might have tried to feed the baby, and they're still just seeming very upset. R resists soothing. So during some of these bouts, your baby may not be able to stop crying no matter what you do. So some of those common things, changing who's holding the baby, the position of baby, playing music, playing white noise, again, trying to feed them, change their diaper, they just might be struggling to soothe. The second P is that pain-like face. So a crying baby may look like they're in pain even when they aren't. Sometimes you might bring your baby to the physician and the doctor might say there's nothing they can do, that they are in fact healthy, but we certainly encourage you to bring your baby in if you're worried that they are in pain or something more is wrong. The L stands for long lasting. So easily these crying bouts can be 35 minutes or so. Some of them can be even, they can total out to be more than 5 hours a day. The E stands for evening. The baby might cry more in that later time of the day. So late afternoon or evening, also known as the witching hour. And that's typically a time for most families when there are many things that we have to do. We're feeling pressured to maybe help older kids with homework. There's bath time, there's dinner, right? We're always cooking dinner for people. And there's also parents maybe who haven't been at work, but they have been home all day with the baby. So you have to think about how tired they are as well. The word period is part of normal development. And the reason that we chose period in there, that Dr. Barr did, is because it does mean that this time will come to an end, like meaning it's just a temporary season that you're in. So this type of crying is characteristic in all infants. Some might be more of a high crier than others. Sometimes people call it colic, but we do like to mention that colic is usually believed to be a condition that some babies have while others don't, whereas the period of purple crying is believed to be in all children in some level or another. And 98% of the time, there isn't anything that a doctor can do about this crying. Unfortunately, the big negative consequence that we have to talk about here is if a parent or caregiver gets so frustrated with the baby and that high crying that they could shake the baby. So shaking a baby is a very severe form of abuse, can cause significant brain damage, blindness, cerebral palsy, or unfortunately even death. So 3 reasons that this is so unfortunate is that our babies' heads are not proportional to the rest of their body, right? Their heads have much more mass to them. Shakers also are much stronger than the baby. Also, the baby's neck muscles are not yet developed, so they have no support for their head. Also, that repeated shaking is so very harmful. So it is, we always like to mention a couple of times throughout the training that it is so very important that after you've learned these program messages, and if you have an infant at home, that you always make sure to share these messages with anyone who would be in contact with your baby, caring for them. So this is our crying curve, and this is included with our app that can be purchased after the training is done. It is developed based off of research that Dr. Brazelman worked on, and he's a Harvard pediatrician. And so to help save infants from the devastating effects of abusive head trauma, this program was established. It is based on 3 lines of evidence. The first being that shaking a baby is an extremely dangerous behavior. The second being that early increased crying is a normal part of child development, and really just reinforcing that. So that's why we have this crying curve that displays the evidence. So it shares that this early crying starts at about 2 weeks, peaks around 2 months, and then does start to go down around months 3 through 5 or 4 through 5, depending on the baby. It's really important to know that this is a typical crying curve, because we do know that this early increased crying is, unfortunately, one of the biggest stressors for parents. The children who are affected by shaken baby syndrome are typically less than a year old, with most of them being less than 6 months old. This knowledge leads us to our third line of evidence, which is that normal crying is a stimulus for abusive head trauma. So this, the research that was done was replicated with the Kung San tribe, and they are located in Botswana. In this tribe, their culture has mothers carrying babies around attached to them. And those babies have pretty much skin to skin contact, and they're able to feed on demand. They also they exhibit the same early infant crying curve, and it's just that it's a little bit more like shorter. So the length of the crying is lesser amounts of time, smaller time periods. Interestingly enough, this research was also replicated on guinea pigs. I don't have as much to say about that, but they also share the same crying curve. So these program messages are delivered through a 3-dose exposure approach. The implementation of all 3 doses in the community ensures that all parents and temporary caregivers receive the critical messages, and it promotes that cultural shift in the way that the community views infant crying. So dose 1 is directed at teaching parents or caregivers before their infant reaches 2 weeks of age. In dose 1, the parents or the caregivers receive the purple program materials, and they're educated through a trained provider. Typically, this might happen in hospital discharge from having your baby from the birth ward, in perinatal classes, in your primary care clinic, or during an in-home visiting appointment. Dose 2, this is a reinforcement approach, and that targets parents around that 2 weeks to 3 months age, and it's during that common high crying period. So in this dose, the trained provider reinforces those messages and delivers the materials to families who have not yet received them. So typically that might look like if the parents come in during that time period, the provider might talk about the period of purple crying. And if those parents or caregivers look confused, that's a perfect attempt to just introduce them for the first time. So then you're kind of covering dose 1 and 2 at the same time, really, because of the time period you're doing it in. Dose 3 contains all the efforts that there are to reach the general population by raising awareness of this program. So we encourage organizations to participate whenever they can. One of the ways of participating in dose 3 that I'm going to be starting, so I certainly look for ideas. It's called clickforbabies.org. And this is an excellent model for dose 3. It now allows people to knit purple caps and have knit-ins, or maybe knit them on their own and have a virtual meeting if they're worried about being in person. But these purple caps then get shared at birthing facilities, or we can share them back to the National Center in Utah. And these caps raise awareness by people seeing these babies in these purple hats and maybe asking, like, what's going on with the purple hats? And it's just a great conversation piece to then start the conversation about the period of purple crying. It would be great if every organization knew about the 3-dose exposure approach or had the ability to do it, but not all of them can, or not all of them have the staff to manage that. So some hospitals might implement dose 1 and they might not do dose 2. That's okay. It's just critical that dose 1 be implemented in a community where dose 2 and 3 are happening. So we need to make sure we have trained people who are willing and able to teach the dose 1 program materials. All right, so I want to share with you some of our recent and relevant peer-reviewed published research. The period of purple crying program model has been tested for over 15 years, and it has been shown to be effective. In 2007, that is when the program materials were made public. So two years later, we had 2 parallel randomized controlled trials. They were published showing a change in knowledge and behavior related to the purple program. These studies were published in Pediatrics and the Canadian Medical Association Journal. In 2018, one of the most important studies supporting the program was published. It was an 8-year outcome of implementation study, and it revealed that the purple program was associated with a 35% reduction in abusive head trauma in children under the age of 2. So this study was published in the Journal of Child Abuse and Neglect, and it was later selected as Article of the Year. So that was a big accomplishment. Following this article, there was a cost effectiveness study, and that was published in the year 2019. So that study showed that every dollar spent on the Purple program had an associated $54 in savings by society. I wanted to show you a look kind of what our dose 1 looks like. So after you go through the training and you sign an agreement saying that you will be willing to share the program information to the best of your ability, you'll be eligible to purchase these packages, right? These Period of Purple Crying apps. So this is what dose 1 looks like. It is something tangible that you can hold with an app code. So it's an app and a booklet package. It's expected to be given to those parents within the first 2 weeks from their baby's birth. Not too fast. It contains a 10-page booklet, an activation code, and the parent reminder card. Parents should be encouraged to download the app and set up an account using the 7-digit code. And then with doing that, they will have access to some of the important stories, videos talking about how crying is a natural part of a baby's life, and the natural, the crying video, the original one that has Dr. Barr on it. So parents can also look at other features of the app. And as you can see on the picture, there's crying, soothing, coping, sleeping. There's different areas. There's even a self-care area. They each of those buttons that you can click contain articles and videos that pertain to the topics. The app also includes a baby development tracker, and we'll look at that in a little bit. Each code that's given per app package allows 5 users to connect. So if you got a package and you put your baby A in there with the code, you can share that app code with 4 other people who then will have access to the baby's information. Inside the booklet, there's also a reminder card. That's kind of what's sticking up. It says, "Dear Parent." So they can place that near their crib or on their fridge or somewhere where they find themselves in their house, where maybe they are when their baby is crying a lot, just to remind them about the messages when the crying is becoming frustrating for them. Another thing that's important to know is that the app and booklet package is provided in English and Spanish, and then we do also have closed captioning available. So we have some supplemental materials that are offered by the National Center on Shaken Baby Syndrome. So one of them is this dad's handout. PCAND provides this for free. We secured this addition to our program in August of this year. So whenever apps are ordered, we send out these dad cards. They're just a single card that's 2-sided. And then we also include a letter, and that goes to the people who are implementing sharing the program at your site, because we just want to mention how important it is to share this card with the dads, not just to hand it out and assume it gets where it needs to go. It's not part of the training necessarily, like the core training. So we just have a supplemental letter as well. And so we do this because one of our intentions this year is to make sure to address and provide information to those primary male caregivers in a newborn baby's life. We have statistics that confirm that this population is unfortunately the #1 perpetrator of shaken baby syndrome, with 50% of them being the baby's biological father. Also, unfortunately, our numbers have increased this year with regards to the number of shaken baby incidents in our state. So this is like some of the screens of the app. On the left, we have the baby tracker feature of the app. So it allows parents to track and record the baby's feeding, sleep, vaccinations, diaper changes, crying, pumping, stuff like that. There's a My Baby feature that allows parents to create a profile for their baby, and then that could be shared and can have notes and pictures in there. There are, the other thing that is very unique and helpful is a baby crying timer. And the timer, you can literally just press start and then stop when your baby's crying. And then afterwards, you can go back and kind of edit it to about a third of it was fussing, a third of it was high crying, and then a third was fussing again. Because one of my sites who started using this program, when they first came to me, they said, we have a baby who cries all the time. And in fact, they found out after using this and the baby tracker that the baby actually isn't crying all the time. It just really does seem like it, right? Because when you're in the middle of it and you're in that moment, it does feel like that crying goes on forever. So it was actually very helpful for them because they were able to figure out when the baby is crying more. So they were able to use that among their staff, and they had some great numbers then and data. So any notes that are made inside of the baby tracker or the app, as if you share that code with up to 4 other people, they can be visible by anyone you share that code with. So again, we do like to mention the importance of parents of all babies, especially those high criers, to reinforce the important messages of the program that you would learn in that 10-page booklet with anyone they leave their child with. So I welcome and appreciate any ideas for sharing this program across the state or any of the programs that I mentioned in the beginning about the work that we do at PCAND. We are always looking for community champions and partners to help us with expanding our efforts. And yeah, if you had any ideas or if you have any groups of people or staff members who you think might be interested in this type of a program, you can email me. I have my email written, but I also have a QR code if you have your cell phone that you can just scan it that way. I will definitely share emails with any of my team members who need to have them if it's not about one of my programs. And so I want to thank you for having me. I also want to thank the North Dakota Department of Health and Human Services, as well as the National Center on Shaken Baby Syndrome. I don't know if Carly has any questions.
Here. I don't know that I do.
Okay.
Information. I'm glad to see there's an app now, I guess. I took they did Period of Purple Crying through a class I took before my daughter was born, and she was born in 2017, but I don't think there was an app then. So nice.
Yes, it's a little bit newer.
I'm all about the data and the tracking and seeing if you can find patterns and all of that. So great. Anyone have questions for Veronica? You can put them in the chat or you can unmute. I think I see any.
That's great. Well, if you do have any, you certainly can email me or get in touch with Carly, right? She can connect us.
Yes, I will. Yes, get them to you if we do decide there's any questions. And your CEU request will also be available right under the recording for this. So I will put all that up for you, and we will see you guys in a couple weeks.
Thank you.
Thank you.
Have a great afternoon, everyone.
You too.